I've got Yusuf joining me today. I'm excited to talk because Yusuf was doing a different model I'm not a fan of before we started working together. And I definitely want to touch on that since I'm sure some people watching will either be doing that model or considering it. So, Yusuf is one of my clients in South Florida. He recently actually had his second kid. He just let me know they are both sick right now.
At
So
this
he
very
is
moment.
juggling a bunch of things. I'm super proud of this guy, and he's been working with me for like about a year now. So, been super cool to watch you get into home health, watch you build the business, and now really grow it. So, let me kick it over to you, Yusuf. If you can kind of give a little background about yourself, please.
Born and raised in South Florida. I started working, this is my fourth year finishing up as a PT, mainly outpatient orthopedic specialty. And didn't really find much growth until later on, I guess, when I decided to do my own thing. I had to get out of the outpatient lifestyle. It's good lifestyle, nice, but in terms of a growing family and life experiences and so on, you kind of have to keep moving and keep growing. And just working in outpatient at the moment is not what I need. So I decided to go ahead and, join a program and learn a little bit more. And now I have my own startup business and home health. So it's
Super
nice.
cool, man.
Yeah.
Yeah, and I kind of mentioned this in the second ago in the intro, but when we first started talking, you were doing home visits, but you're doing it under outpatient Part B,
I
mobile
was doing
outpatient.
outpatient Part B while still working in outpatient and slowly leaving outpatient, like in the clinic, to doing mobile, I guess, Med Part B. And from there, that's when I wanted to get to know a little bit more about Medicare Part A and this model in terms of home health.
Yeah, I remember we did the call, and usually I talk to a lot of people doing mobile outpatient, Med Part B, whatever you want to call it. Usually they're doing 4 units, which is 53 to 67-minute visits. I remember our call because I think you were doing five, and I think were you sometimes doing six? Am I remembering that right?
So I was working in a model where I was the main supervising PT. I would just do evaluation, progress notes, and discharges. And I would see patients for 4 units to 5 units, thinking that first of all, I was making more money staying there longer, which is false. And then at the same time, I my schedule was just not super full because all the follow-up visits were being passed on to the PTAs. So I'm not getting busier. I'm not getting to what I want to do exactly. And it takes time to build that up. And that's when I decided to join and kind of learn a little bit more when it comes to the program. And I got busy real quick.
Yeah. You said it wasn't like the more time wasn't really more money. Were you paid per visit or per unit with that company?
Per unit, they paid by the units.
Yeah.
And depending what it is, if it's a evaluation or a progress note and so on, you get paid a little bit more for an eval. But at the end of the day, it was per unit. So I used to give myself a cutoff, like I need to be out here by 53 minutes because I need to
Mhm.
move on to my next one. Or, 68 minutes for the fifth unit. I'm like, this is not going anywhere. I can't do this long term. So I
Yeah.
need to get out of that too.
And I remember you said you just weren't that busy. So probably some of the 5 unit was like, if the patient needed it, I can do 5 units.
Yeah, if
I'll
they needed,
take what I
I'll
can
stick
get.
around a little bit longer if I didn't really have anything going on next. But and that was what was the case for the most part. I wasn't super busy, and I needed to go ahead and I just kept myself busy with these evaluations and so on.
How does the pay compare for like a 4 unit, 53 to 67-minute visit versus a home health visit?
It's been a while
You're
since I.
calculating the units. I see it.
Yeah, it's been a long time. I remember I used to get $45 for the eval plus maybe $11 or $12 per unit.
Yeah.
So if it's 5 units, 55 plus 45, which is what, 100, if that, right? If
55 plus 45. Yeah. 100.
but I won't not every eval will get 100. It'll probably be like 90, 95 per eval, depending. And then depending on the insurance, like I don't have to do any just the eval, I don't have to do any treatment. I could just leave. So 20 like 15, 20 minutes or 30 minutes in the patient's home and I'll get a full $85 or something like that. But it's still not worth it. It's still not worth it. I'm
Mhm.
there for a very long time. If I'm there to do 5 units, which is 68 minutes. So by the time I get to my
68 to
next
82 minutes,
Yes,
I think. Yeah.
68 to 82 minutes. That's correct. Yes. Then I would have to, it'll take me another 15, 20 minutes to get to my next patient. But if I do home health part A, 40 minutes minimum, within the hour, I'm on to my next patient. It makes
Yeah.
sense. It makes sense where now, I mean, I could hit three patients within Medicare Part A and then at the same time, it will be only two patients with a Medicare Part B.
Yeah.
So I give myself an extra visit just by the time I save and being able to go to the next patient faster. So it
Yeah.
worked out for me that way. That's the way I looked at it.
Well, yeah, and the other piece is you weren't getting enough referrals with the other one versus now. Like I know on the call, I think it was last week. How many visits you recently counted? I think was it how many visits did you do in that busy week
Um,
recently?
within that busy week, which was like, basically all of November until those PTAs came involved, I was seeing, I would say, between 35 to 42 visits a week
Busy.
and busy. Like
Two
I have no,
kids.
two kids, just everything, and I have no time for anything. I would see eight patients on a Saturday. That's how busy.
Wow.
Yeah,
Yeah.
because I have no time. There was a point in time, I think during Thanksgiving, I try to see some patients on a Sunday just to kind of give myself some free time to, enjoy some time with the family. But I was very busy, yes.
Yeah, because, and I talk about this in the program with my four-step framework. The first thing we need to do is fill your schedule. When you were doing that other company, you were super slow. You didn't have enough referrals. First thing we got to do, fill your
They
schedule. Maybe we
they just texted
overfilled it.
me. They just texted me from that Med Part B or that mobile outpatient.
Yeah.
They asked me because I haven't taken any other cases from them recently in like months. They asked me if I wanted to stay on or should I or if I should, they should close me out. I'm like, you could close me out. Thank you for the opportunity. And
End
and
of
that
the
was it.
chapter, man. Congrats.
Close. That's
I mean,
it.
that's cool. That really
Yeah.
is cool though, because now you
They
are
said,
a business
yeah,
owner.
and they said to me if I want anything in the future, they could, I could always reach out. I'm like, yeah, sure. But I'll close the book for it on it for now. But yeah, as a business owner, learning about how to start up the business and kind of know the little tricks and things in between the lines. Really got that set up, and now it's doing well. So I have my LLC, I have my DBA. I learned some tax credits or tax exemptions in terms of benefits, right? In terms
Mhm.
of taxes. I just recently bought myself a new car. Not the smartest decision, but I did it. I needed it for the family. But I wouldn't have been able to do it with when it comes to Med Part B. I don't think I would have, or even if I stayed in outpatient, it would have been very hard to get to what I got recently. So
Cool, man.
yeah,
Congratulations.
thank you.
Yeah. You're talking about how the schedule got super, super busy, which was the goal. After that, the next stage is hiring people because there are only 7 days in the week. It sounds like in Thanksgiving, you're nearly doing 7 days of the week.
I tried.
And that's when I think you just recently made some hires. So kind of tell us a little bit about that.
So I hired two originally and got the third one on. Still trying to do more with him as well. I'm constantly actively looking for more employees or more people to help me out in different areas, especially just kind of spread myself out. But now that I have the free time, I could finish up my notes. Before I was backed up on notes. Now I can finish up my notes and at the same time look into the next move and set goals for myself for the next 6 months or so. So as I said before, I was planning on in the next 6 months signing up, talking to more agencies, contracting with more agencies, hiring more PTs, PTAs, and starting up the OTAs. I haven't touched that market yet. And from there continue watching it grow. And it might take some time to build up the caseload again, but I'm not worried about my caseload at the moment. I'd rather just pass everything on to my people, and have them make sure that they're happy before anything. And if they're not able to go ahead and keep myself available, so if they're not able to see a visit, I'll go ahead and make that visit if I need to. So it's trying to really just grow and focus on the business.
Yeah, you're doing the right things. You're acting like a business owner. You're trying to get your staff as busy as they can, trying to keep patients off of your schedule so you can actually have the time to do everything that's needed to grow the business. And
Yeah.
I know you just hired these PTAs for that recent busy month. It was really basically just you at that point. What was the revenue looking like in that busy month?
It was mainly me, but revenue that came in, if I had to take a guess, it was between 11,500 in between somewhere around there. It could be close to 12. And that week that the PTAs came in, it was literally like the week of Thanksgiving, the last week of November.
Yep,
So the true numbers in terms of what the potential could pop up within this month of December if I get more referrals. So
yep,
especially with one of the PTAs that work for me right now, she's seeing between 6 to 7 of my patients. We're discharging
right.
two, but she's still seeing 6 to 7 of my patients. So average out between 14, that's probably about 14, 12 to 14 visits that she's seeing by herself. The other PTAs I'm working on getting them busier. So then the true revenue will show probably December, most likely around January, once things kind of get more settled.
Yeah, that's super exciting. And I know you were talking about like the goals for the next 6 months. You know, you're talking about hiring more therapists, more agencies. What does that look like?
A lot of phone calls, a lot of time on the computer, looking actively looking and hiring. Speaking to either the PTAs that I know currently, trying to recruit more, and then also trying to talk to more of the agencies and contract with more agencies. That's, I feel like, the biggest game changer. Speaking to the agencies, contracting with them. I sat down with one earlier this week, and I spoke to one on the phone. So if I could get them on, then it'll be my fourth agency. It'll be four agencies total, five agencies total that I contract with. But the idea is to continue growing from there.
Yeah, that sounds
Trying
awesome. Yeah, I was going to say, if you just did, 11,000 ish last month, you get more agencies, which sounds like you're about to bring on two more. You hire more therapists. I know you talked about like 6 months down the road. What's the revenue goal mid 2026 then?
I didn't think of that question actually. That's a good question. If I could in 6 months could get into the 25 to 30s in terms
Mhm.
of revenue, I think that will be solid. I think that will be a good work, and to see what's the potential like. But I think 25 to 30 could be a really good, reasonable, rational number to look at for the next 6 months. So basically, and that's with me all obviously also working with them and trying to push it. So the revenue is also part of me, but try to really get more involved with the assistants and others involved too.
Yeah, I think that's an extremely reasonable number. I could definitely see you getting there. And I think part of the picture would be, yeah, you're still seeing some patients, especially with the PTAs, but I think you would not be working 6 days a week. Like, I think the schedule would be lighter on the personal side, which I know is
I'm
part of
trying
your
I'm
goal
trying
as
to get back
well.
to the gym to be honest. So it's like if I could get to myself where I could be like today would have been a perfect example. I could have gone today, but I didn't. But consistency later.
Yep. Yeah, I mean, two sick kids, like you're working on the new company, you got a lot of things going on. But now, as you start to hire other therapists, this is how we get out of the daily field of seeing all the patients. The company grows, you get more time with your family. Like that's what the next 6 months is heading to for you. So I'm glad you're starting to hire therapists now.
That's what I need. I need to spend more time with the family, more time with the kids. Helping around my kids are, they're a lot of work. They're definitely a lot of work.
I love it because on all the calls, you always have the baby, you're like
Yeah,
burping the
I have the
baby or
baby
feeding the
here
baby.
and I'm shushing the other toddler.
I love
So
it,
it's
man.
it's, it's nonstop. It's nonstop. So I definitely need to have some time. Well, I need to manage time, and I can't manage the time when I'm seeing between 7 to 9 patients a day every day.
Yep.
That's what I was seeing in front of me. 7 to 9 patients every day, 6 days a week. So
Yep. That's why
it
you're
comes up.
hiring now. It's
Yeah,
perfect.
yeah.
Cool, man. Well, thanks so much for doing this today. Like I said when we started, like it's been super cool watching you grow, build the company, get out of the other model, see the light with this one, and now start to hire therapists.